Subdivided into vestibule, which is the space outside the teeth, and inside the teeth is the oral cavity proper. Oral cavity proper runs caudally all the way back to the palatoglossal arch. Palatoglossal arch, that's the caudal extent of the oral cavity proper. Then that begins the oral pharynx, which goes caudally back to the base of the epiglottis. So this space between the palatoglossal arch and the base of the epiglottis, oral pharynx. The normal position of this epiglottis is up in the nasopharynx like that. Okay. So that's when I talked about when you open. Sometimes when you open the dog's mouth, all you look back there and see is soft tissue.
Yeah,
so what you do is you lift up that soft palate, which allows that epiglottis to pop forward, and then you can intubate the dog.
Yeah,
okay. All right, so then we talked about the nasopharynx, and the boundaries for that are the choanine. Choanine is the junction between the nasal cavity and the nasopharynx. Okay, nasopharynx runs caudally all the way back to the palatopharyngeal arch. So all of this space is nasopharynx.
Where's the
opening
palatopharyngeal arch?
Right there. If you follow the lateral border of the soft palate, the caudal extent, lateral border, that ridge going around is the palatopharyngeal arch. That's the caudal boundary of the nasopharynx. Okay, and the opening into the nasopharynx is the auditory tube or eustachian tube, and it connects the middle ear cavity or tympanic cavity with the nasopharynx. And the last subdivision of the pharynx is the laryngopharynx, and it goes from the palatopharyngeal arch back to the pharyngoesophageal limen. The word limen means threshold, so this space here is the laryngopharynx. Okay?
Thank you.
Is that good?